All right, thank you very much. So feel free to ask questions during this, and just like he said, just a brief intro. My name's Mike. Moved out from Wyoming, Cheyenne, Wyoming, about 8 months ago, where I did have my own company for hearing conservation, noise sampling, monitoring, all sorts of everything related to hearing. Okay. Before I did that, I worked with a subcontractor of a major military company where we developed a new type of hearing protection for maintainers of the F-35 fighter jet. So during that process, I've actually sampled noise, been around, and don't put me in jail or anything, but I've actually been 157 dB sustained noise. So you're talking about loud. That stuff is so loud that you can't breathe. It's incredibly intense. So that's just a little bit of my background and how I've developed my passion for the sense of hearing. And I want to share a little bit about that with you today. So we've got a lot of safety professionals, some industrial hygiene in here, and again, I've worked with all of you, your cohorts, in military settings, oil and gas settings, so I know a little bit of the noise that you've been in. And I also understand the multitude of tasks that you have to do. Usually, you're going to focus on people dying and keeping them safe from that. Helmet safety. Brick falls on your head, without a helmet, you're dead. Versus, hearing, it takes a little while for that kind of damage to come to place. So oftentimes, it can be overwhelming for industrial hygienists, for safety engineers to just focus on hearing. So it gets overlooked sometimes because, again, it doesn't kill you right away. It's more of a cumulative effect over the course of years and decades before you see an injury occur. What I really want to talk about today, though, is a little bit about hearing and hearing conservation, why that's so important, and why it's important that you guys do your jobs very well and make sure people are in compliance with that. But when people are in loud noises, it's not that they just lose their hearing, which does suck. Nobody wants to lose their hearing, but they also gain something called tinnitus or tinnitus. So who calls it tinnitus? Raise your hand. Okay. Who calls it tinnitus? All right, so they're both right. It's tomato, tomato, it really doesn't matter. But I call it tinnitus because if you call it tinnitus, in medical terminology, itis, I-T-I-S, means the inflammation of something. Dermatitis, inflammation of cellulitis, inflammation of whatever, bronchitis, inflammation of bronchial tubes. Well, with tinnitus or tinnitus, we don't know if it's an inflammation of anything or not. So when you put the itis at the end of it, that's why I think it makes it more medical than it really needs to be. So tinnitus is, in general, in medicine, what most people call it. But tinnitus really doesn't matter, okay? So with noise exposures, not only do you lose your hearing, normally you'll see an audiogram, a little dip in the high frequencies at 4 kilohertz and comes back up. I won't go into detail. I'm assuming you guys already know a little bit about that. But you can't understand the high frequency sounds like S, T, T, H, P, K, those type sounds, which we call linguistic descriptors. Noise damage will reduce those. So you hear everything, but you can't understand. It sounds like you're mumbling, especially in background noise. Go to a Texas Roadhouse with a high frequency hearing loss, forget about it. You're not hearing anything. Everything just gets mumbled together, okay? So that's the hearing loss portion, but what's I would argue as equally as important as the hearing loss that you receive from noise is the gaining of tinnitus, the constant ringing in your ears. Who here has it? I do. I've had it for 18 years, okay? So, and those are the people I see. That's one of my specialties. Hearing conservation, which is directly related to tinnitus, because most everybody that has noise-induced hearing loss is going to have tinnitus as well. If you don't, then you're in probably in about a 10% margin there that actually don't, okay? So what is tinnitus and how do we deal with it? That's what I want to focus on now, and how do we prevent that from happening? Okay, so tinnitus. It's a phantom sound. It's something that I hear. I've dealt with mine for 18 years now, and it used to drive me nuts, okay? But it's a sound that only I can hear. You can't hear it. I can't hear yours. You can't hear mine. Okay? It's a phantom sound, but it is legitimately there. So imagine sound now as rivers of sound coming in, okay? We've got 2 rivers coming in, and it's going through our ears up to our brains. Now, keep this in mind, too. When you hear, you don't hear with your ears, okay? The ears are just the mechanism to get the sound to the brain. You hear with your brain. So we really want to focus on what's going on in the brain. The ears are just the mechanism to get it there. So imagine this. You got 2 rivers of sound coming in. It's going through your outer ear. It hits your eardrum, which vibrates. then it moves a chain of 3 middle ear bones, they vibrate, then it vibrates your inner ear, which is filled with fluid, which makes the fluid vibrate. Then there's hair cells in there which move in response to the fluid. When those hair cells move, it releases a neurotransmitter that makes it into an electrical signal, which goes down your 8th nerve, then to your brainstem, then your thalamus, then your limbic system, and then you understand speech. Okay? I'm not trying to confuse anybody. It's just, there's a lot to it. Okay? Hearing is very intricate. It's neurology. It's very precious as well. And when you lose it, it really sucks because it's really hard to deal with the ramifications of that. So what happens with sound? Again, my vocal folds are vibrating right now. It's vibrating air, and it's triggering that thing that I just explained, okay? So the sound is coming in, the rivers are coming in, and when the rivers come together, they converge at the brainstem, okay? When that sound comes together, it's at the brainstem. That's where I want to focus. Because tinnitus is not happening outside. It's processed the same way, but the sound that's coming in right now, these vibrations, it's going through that river, it's going through the same channel, but tinnitus is generated either in the inner ear, called your cochlea, or on the nerve connecting your inner ear, or the brainstem itself. We don't care where it's generated in that part, it's just generated there somewhere. Usually with noise-induced hearing loss, which is what you guys are tasked with making sure people prevent, it's going to happen in the cochlea. You're going to have damage to those hair cells that are moving, okay? When those hair cells are damaged, that neurotransmitter is going to be going constantly. So you hear a beep all the time. Or there's so much damage in that inner ear that your brain knows that there's damage there. It's really hyper-focused on trying to get sensations from that specific sound. So you're paying attention to it constantly. So much so that it's generating its own sound, a phantom sound, something that you can hear that no one else can hear. And that drives people nuts. About 3 million people get tinnitus, okay? In my office, that's mainly what I see is tinnitus patients. Several people are suicidal because imagine you hear a train, freight train, constantly, 24/7. You can't sleep. You can't have a meaningful conversation. You fixate on it, and it drives you crazy, okay? That is in a lot of people with noise-induced hearing loss, that is a direct product of that sound. So how do you deal with that? People need to understand that there is hope. A lot of doctors, a lot of ENT physicians will tell people, well, you got ringing in your ears, I'm sorry, there's nothing we can do for that. You just have to deal with it. It may or may not get better. What happens then is people lose hope and they get desperate, and that's when they'll kill themselves, okay? And it happens all the time. So don't take it lightly. It's not just when you're losing, or when you're in noise and you're losing your hearing. It's not just that you're losing your hearing, you're gaining this horrible sensation. About 3 million Americans are clinically affected by it, okay? And what my job is when those people come to me and they hear from a doctor of all people that, oh, there's no hope, you just have to get used to it, that can set them off, okay? But that's not true. There's a lot that we can do for it. Now, we can never cure it. You'll always hear the sound, just like I'm always going to have my buddies with me, my beep and beep. I've got 2 of them, they're always going. But it doesn't bother me anymore, and that's what we can help people with, is we can get them to that point where it doesn't bother them anymore. The basics on how we do that. You got the sound coming in, it's generated, it goes to your brainstem. Well, the next step that the sound takes after going through the brainstem is called the thalamus. The thalamus is called the sensory gating system of the brain. It decides what to pay attention to and what to forget. The thalamus is the reason right now none of you realize you're wearing shoes until we talk about it. Now, oh yeah, now I'm wearing shoes, okay? It's not important. Those nerve endings that are sending sensations from your toes to your brain that there's a shoe on there, now that we're talking about it, you can probably feel it, but when I'm talking and you're listening to me, what's more important to pay attention to is my voice, what I'm speaking about. So your brain will take those sensations from your feet and put it into the subconscious. Okay? That's the job of the thalamus. It does it all the time. We have to have the thalamus working in order to function in life. Otherwise, we're paying attention to too much stuff and we can't get anything done. So with tinnitus, when that sound is there, the brain is looking around. It hears this beep, sometimes a roar, sometimes hissing, sometimes bacon frying, sometimes crickets. It doesn't matter, it's all sound, okay? And the thalamus hears this sound and it freaks out. It's like, where is this sound coming from? I can't identify it. Uh-oh, we got to pay attention to it. So you pay attention to it, then it goes to the next part of your brain called the limbic system. The limbic system is in charge of your emotional responses and your fight or flight response. So, let's say right now outside a gun goes off, okay? Hopefully nobody's heard, it's just a sound, okay? What happens? It's loud. We're all like, whoa, whoa. Eyes get big, heart starts beating, adrenaline's released through our body. Why? because that sound, that's all it is a sound. So what we're perceiving, it goes through that thalamus to your limbic system and it creates an emotional response, okay? In this case, it's the fight or flight response. So you're ready to do something, okay? And you have a legit, your body's affected by it, right? We've all experienced that. It scares you, okay? Well, tinnitus, when you get that hissing going on, it hits the limbic system in that same spot. And everybody's response is going to be different. Some people come to my office crying uncontrollably as soon as I start talking about it because, oh, how am I going to deal with this? And that's a legit response. They can't control it. Other people want to punch me. I'm not joking, because they get angry. How am I going to control this, doc? I've heard that. There's nothing I can do about this. What am I going to do about my tinnitus? How am I going to get my life back? You answer right now. Legit, that happens. It's an emotional response. Most people come in and they're annoyed. That's where I fall. So, crap, here's that tinnitus. My day's gonna suck. I'm just gonna hear it all day. It's really, really bright. So that sound hits my annoyance spot in my limbic system. When it annoys me, I try to forget about it, but when I try to forget about it, I actually wind up paying attention to it, which makes it louder. When it's louder, it annoys me. When it annoys me, I try to forget about it, which makes me pay attention to it, then it gets louder. See the cycle? It gets worse and worse, okay? That's what tinnitus is. Well, we can break that chain, we can break that cycle. It's a long, involved process, okay? But there is hope. If you run across people that have that, let them know that, because they can come to an audiologist or a cognitive behavior therapist that's trained in this stuff, and we can give relief from it. We don't want anybody to kill themselves because of tinnitus. But keep in mind, it does happen, and oftentimes it will happen because of noise exposures. Gunshots, 85 dB over 8-hour time-weighted average can cause it. And we need to understand that. We need to prevent it from happening. One of my main reasons for being here today is I want you guys to put me out of a job. I mean that legitimately, okay? This whole thing of hearing aids, they suck. They're $6,000 for a good set of hearing aids. You put them on and you're still not going to be able to hear all that well. You can hear better and it should help people a lot, but it's not going to be like it used to be. So prevent that from happening in the first place so that you don't have to go through spending $6,000 every 4 years, not understanding your grandkids, having to put something on your, changing the batteries, getting ear infections, all this stuff that's associated with the hearing loss. Just prevent it to begin with. It's going to save companies money that are in compliance. It's going to save people money that are having to deal with hearing loss. It's going to keep people sane because they're not hearing the ringing in their ears. But I'm realistic. I understand this stuff is going to happen. We're an industrialized nation. It does. And that's part of what you guys are here to do, is to help protect people, to make sure that they don't have these things. So, what I'm going to argue for is this. Each of you have this. It's called a Tinnitus Handicap Inventory. You can take a look at it. And in hearing conservation programs, you have your protocol set up. You have, you need to make sure you have a KAC certified individual running the hearing test. You need to have these noise analysis done. You need to make sure they're testing 5124 kilohertz, blah, 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 blah. Okay. What I've never seen done well, I've seen a couple companies do this, but I've never seen them do it well, is address the tinnitus on their introductory audiogram, on the pre-employment audiogram, if you will. And the reason I think this is important is, remember, tinnitus is subjective, meaning you can't hear mine, I can't hear yours. I can't stick a probe in my ear and measure what I'm actually hearing, the sounds that are happening, but it's definitely there. So in medicine, when we're trying to treat tinnitus, what we do is we take a subjective condition and try to make it as objective as possible so that we can track results. And this is the best tool we have for it. It's called the Tinnitus Handicap Inventory. 25 questions, yes, sometimes no. They're weighted. All the yeses are worth 4, sometimes it's 2, and no is 0. And you can read through them. Because of your tinnitus, is it difficult for you to concentrate? Yes or no. Do you feel that you have no control over your tinnitus? Yes, sometimes no. And you circle those, and you get a baseline response, 0 to 100, okay? In my clinic, what we do, if you're clinically significant, you have to be a 36 or above. What I would argue, if you're setting up a very effective hearing conservation program, start off with that. If people don't have tinnitus, just note that, no tinnitus observed. If they do have tinnitus, mark how severe it is, and then at your annual audiogram, have them do that again to see what's happening. Because over half of my patients that come to see me do not have hearing loss, but they have severe tinnitus. Noise can cause tinnitus without causing hearing loss. You know, when you take the hearing test, you push a button when you hear a beep, or raise your hand when you hear a beep. I don't really care about those sounds. Okay? As an audiologist, they're important for programming hearing aids and they're important for diagnostics. but it doesn't really mean that much, because what we're doing is we're testing part of the ear called the outer hair cells, and the outer hair cells are what send that sound to you. There's another set of hair cells in there called the inner hair cells, which are more responsible for understanding speech. So those are the ones that we really care about, and those are the ones that are going to be damaged in people that don't have hearing loss, that do have tinnitus. So hopefully that makes sense. So when you're going through it, hopefully you have a little better understanding now about what tinnitus is and the negative effects that it can have on your life. 3 million Americans suffer from it. About 3 million Americans are clinically significant with tinnitus. And oftentimes it is because they have been exposed to noise. It's not always occupational. Sometimes it's shooting guns. Sometimes it's firecrackers. People are genetically predisposed to get it. Sometimes it happens. Sometimes it's unilateral. Usually it's both ears. It presents itself differently for everybody. But the truth of it is it creates a response in you. And all it is sound. And that's my job, is to explain to people, it's just sound. Even though you may hear a roaring freight train, it's not going to affect your understanding, okay? It's going to affect your attention. Your thalamus, that thing that's paying attention to everything, it's going to just focus way too much on that ringing in your ears. Well, we can retrain you to not focus on it so much, so that even though you will hear it, you're not going to focus on it. You'll still be able to hear people. Just categorize that sound as sound. It's neutral. You don't love it, don't hate it. It's part of you. Accept it. But that's what we do with the tinnitus rehabilitation therapy, and that's what we can do. But I would argue that going through that process is arduous. To get good relief, it takes a bare minimum of 2 months. Usually it takes a couple of years for people to get good relief from that tinnitus. We can prevent that on the front end by keeping people safe in noise. Okay? So that's my spiel about tinnitus. So I'm going to stop. I've been talking a whole lot. Let me just open up the floor. Any questions about this or anything ear-related?
No, please. Your hand is up first. I have read, and I know our standard is 85 dBA, but I have read where damage, now they've found that damage can start 75, 73. Do you have a
Yes.
Do you have a range? Can you?
So OSHA 1910.95 is based off of 85 dBA time-weighted average, 8-hour time-weighted. That's where you have to start it, but then you're not required to use protection until 90 dBA for over 8 hours. Okay. So that being said, the damage risk criteria was developed from ANSI S12.13. I can't remember the number off the top of my head, but you got to remember, it's a damage risk criteria. So there's a criteria that's put into play by all these smart people that develop this. And what it actually means is if you're protecting people at a level of 90, which is what the standard says, you're okay with 25% of the population having hearing loss and even more having tinnitus. Okay? That's the cutoff. So yeah, you're protecting 75, but that 25%, there's a good chance that a lot of them are going to have hearing loss. If you're more conservative and you use the NIOSH standards of 80, you have to have hearing protection at 85 dB with a 3 dB exchange rate. Are y'all familiar with the exchange rates? Okay, so more stringent, and we don't have time to go over all that right now, but more stringent, even at that more stringent level of must be protected at 85 dB, you're still going to have about 6% of the population that's going to have hearing loss and tinnitus because of that. You can't protect everyone because everyone's just genetically predisposed to hearing loss or not. So people are going to get that. And those are the people that are coming to see me. Those are the 6% that are going to, Dr. Goforth, what am I going to do about my tinnitus? I can't hear to my kids. I'm not emotionally available anymore. I can't have a meaningful conversation. My life is over. Those are the ones that I see. So I would argue that protect people at 80 and 75, it's going to happen. Some people are going to have medical conditions where you're going to lose your hearing regardless. It doesn't matter. But if you're protecting people at a level of 80 and below, then you're going to be in good shape. Okay? Doing that can be a little bit difficult to some people because general industry, I think, is on average, just between 85 and 90. You don't need much protection, but a little bit will do it. You also have to worry about overprotection. Okay? I wish I had a lot of time to talk to you because you're basing the hearing protection off of the NRR, the noise reduction rating, right? You know what I refer to that as? Not really relevant. It doesn't mean anything. Okay? It's just a set of numbers that were developed through this process. You're using C-weighted noise measurements, and then you have to derate by subtracting 7 because it's an A-weighted noise measurement, and then when you're actually referring people, you have to cut that NRR in half. So what does that even mean? There's better ways you can do it. We have devices now that are called personal attenuation rating devices. So you can put hearing protection in and you can get what an individual is actually being protected at. Because remember, when you're doing this NRR, you're basing that off of population statistics. Okay, that's fine. You have to do that, I understand. But are you a statistic? Are you? Are you? No, we're individuals. Everybody's going to be different on how much protection they get. So why don't you just take that next step of verifying how much somebody is being protected? You can. It's called a personal attenuation rating. There's tons of ways you can get that. 3 commercially available systems that I know of, and I've been out of that part of the industry for 2 years now, but there may be more by now. But that can be done. So, and the reason I would argue that you should do those is for the people that are in the noise that need to be able to hear, alarms, and that alarm system is known. You got to be able to hear 75 decibels. Well, if you have a big yellow foamy in there, and you put it in properly, that could potentially take your noise, your hearing down by about 45 decibels if it's fitting really, really well. Well, if that alarm's at 75 and you're taking it down by 45 and you have a little bit of hearing loss, you're not going to hear the alarm. You might get hit by a train. You have to worry about overprotection as well. You need a very specific amount of protection for each individual. Okay? So some companies have it in place. I've helped people put these into place, and it works tremendously. The difficulty is it takes time and it takes money. Okay? But there's a return on investment. If you can show the management people that you protect your people, you're not going to have as much worker compensation to pay out. You're not going to have to buy hearing aids for these people over the life of their life. It's easy to make that case. It's just oftentimes when you're dealing with safety, you're worried about fall protection, you're worried about head protection, you're worried about hazardous materials, you're worried about all this other. There's so many hats that safety professionals have to worry about that hearing is not really one of them that makes the top cut because it's not immediate. It's not like, again, you drop something on your foot and it breaks your foot. It hurts like crazy. You're going to the doctor. You're going to seek help immediately. Well, hearing can take decades to manifest itself. People don't understand that. It occurs gradually. But the effects that happen when you're 40, 50, 60 years old, you can't hear your kids anymore. You can't hear your grandkids anymore. You can't do the hobbies you want. So what happens often is, you're out at a restaurant with your friends, and at first, you hear everything, you're having a good time. Next, everybody's laughing. Aha, that's a funny joke. You didn't hear it, but you're still laughing and give a courtesy laugh because that's funny. Eventually, what happens is you get tired of doing the courtesy laugh. You'll still go out with them and have a good time, but you just don't laugh anymore because you're tired of having to put that energy into it. Then eventually you get to where, I can't understand this. It's not worth it. I'm just not going to go out. Then you stop going out with your friends. And then that's when everything else starts to kick into place. That's when you start to become socially isolated. That's when you start to get depressed. That's when your heart starts to fail. There's so many medical conditions that come from hearing loss that people don't understand. Hearing is one of your basic 5 senses. It connects you to people. Helen Keller, remember Helen Keller? No vision, no eye. She says, vision, it takes you away from things. Hearing takes you away from people. So that's what we got to have. We have to have human interaction. You got to be able to hear. Protect it at all costs. It's very, very worth it. From a personal level, from a return on investment level, from monetary, it's so incredibly worth it. So your job is very important. I just want to encourage you with that. And keep in mind, it's not just that that people are losing their hearing because of the noise, but they're gaining tinnitus. And that's equally as damaging.